Good day and Assalamualaikum. I am Dora Abdullah Manalundong, a nursing student at the Main Campus. So now I will be assessing the breast and axillae. So the definition of it, our breast are paired mammary gland that lie over the muscles of the anterior chest wall, anterior to pectoralis major, and serratus anterior muscles. So the purpose of it is to identify signs of breast disease and initiate early treatment. So the equipments are centimeter ruler, gloves, and PPE as indicated. So considerations before, during, and after the procedure. Introduce self, verify the client identity, and explain the procedures. Inquire if the client has any history of allergies, perform hand hygiene, and provide for client privacy. So the things to document after the procedure. Document all findings, normal and abnormal response of the client to the procedures.
Explain the procedure and provide privacy. This is to gain patient's trust and cooperation. Inspect the breast for skin condition, size, symmetry, and contour or shape. It should be smooth and dimpled and the same color as the rest of the skin. Inspect the nipples and areola for size, shape, symmetry, color, surface characteristics, and any masses, lesions, or discharges. This is to note presence of abnormalities. Ask the client to raise her arms over her head and place it behind her back. This is to provide visibility and conclusive data. Inspect the axillae for skin condition and hair distribution. This is to note presence of abnormalities. Inspect the client in these positions: sitting with arms at sides, sitting with arms raised overhead, sitting with hands pressed on the hips, sitting and leaning forward, supine with a pillow under the shoulder or the breast being examined. These positions may help detect skin or nipple dimpling, which may not be obvious. Some positions may also help reveal subtle breast or nipple asymmetry. Palpate the client's breast using the finger pads, index, middle, and ring fingers. Palpate using the vertical strip method, pie wedge, or concentric circles. These are the most effective methods to ensure that the entire breast is palpated. Palpate the nipples and areola. This is to note tissue elasticity and tenderness. Squeeze the nipple gently between the thumb and index finger. This is to check presence of tenderness and discharges. Palpate the axillae and clavicular lymph nodes. This is to check for any tenderness, masses, or nodules. If a mass is detected, record the location using quadrant or clock method, position, size in centimeter, mobility, consistency, degree of tenderness, and shape. Further evaluation may be done after finding a breast lump during assessment. Masses may be investigated with a biopsy.